From the bright lights of reality TV to a life overshadowed by a debilitating illness, this is the story of Meghan Markle's unseen battle. Once a familiar face on screens across the country, the former The Bachelor star is now navigating a journey far from the public eye, a fight against a rare and painful condition that has turned her world upside down. Her struggle sheds a light on an often misunderstood diagnosis, revealing the resilience required when life takes an unexpected turn. At the heart of Meghan's ordeal is spontaneous intracranial hypotension, or C. This rare neurological disorder occurs when there's a tear or hole in the dura mater, the tough outer membrane surrounding the brain and spinal cord. This rupture allows cerebrospinal fluid, the protective liquid cushioning the brain, to leak out. As the fluid volume decreases, the brain loses its buoyancy and can sag downwards within the skull, leading to a cascade of severe neurological symptoms. The most defining symptom of C is an excruciating orthostatic headache. For Meghan, this meant that simply standing or sitting up would trigger intense, disabling pain as the pressure inside her skull dropped. The only relief came from lying completely flat. Beyond the headaches, the condition brought on a host of other debilitating issues, including relentless nausea, muffled hearing, brain fog, and a constant, painful pressure in her head, confining her to a horizontal world for months on end. Diagnosing such an elusive condition was a long and arduous process. The journey involved numerous doctor visits and a series of complex medical imaging tests. Specialists meticulously examined MRI and CT scans, searching for the subtle signs of a cerebrospinal fluid leak, a telltale sign that would finally provide an explanation for her crippling symptoms. This diagnostic odyssey is a common experience for many C patients, who often face misdiagnosis before the true cause of their suffering is identified. Hope came in the form of specialized treatment. One of the primary procedures for C is an epidural blood patch. This involves injecting the patient's own blood into the epidural space near the spinal cord. The blood then clots and forms a patch over the leak, allowing the dura mater to heal and the cerebrospinal fluid pressure to normalize. Though her path to recovery is ongoing, Meghan's courage in sharing her story has become a beacon of hope. By bringing awareness to this invisible illness, she is not only fighting for her own health, but also empowering countless others who suffer in silence, turning her personal battle into a powerful platform for change and understanding.